A few years ago, my grandmother passed away from pancreatic cancer 3 months after she was diagnosed. Her blood biomarker for early detection of pancreatic cancer was not elevated until it was too late. And as a stage 4 pancreatic cancer patient, there was no treatment options available. It was a really hard and sad 3 months for my family and I do not wish that on anyone. But it is stories like this, and there are many of them, that has made pancreatic cancer notorious as the silent killer of cancers. And despite the recent advancements in cancer therapy, like immunotherapy and targeted therapy, the death rate for pancreatic cancer has not improved for the past 2 decades. The question is why? I think one main reason is that the models we used to study pancreatic cancer outside the human body are not ideal for that purpose. When we talk about cancers, even as scientists, it is easy to tunnel vision on cancer cells only. But cancers are more than just cancer cells. There are immune cells, there are fibroblasts, there's extracellular matrix. And this non-cancer cell component forms up to 80% of pancreatic cancers. Yet the models we use to study the disease do not take that into consideration. So in my research, I did 2 things to try and change that. I grew cancer cells in 3 dimensions. These are called tumor spheroids. These spheroids are as easy, replicable, and affordable to grow as the conventional 2-dimensional methods of cell culture, with added features that makes them resemble pancreatic cancer more, like extra production of extracellular matrix. Next, I asked, what is a unique feature of pancreatic cancer? And an answer was hyaluronic acid. Yes, it's that thing that you add to your skin to moisturize, and no, you're not gonna get cancer by doing that. In pancreatic cancer, it is produced in large quantities compared to normal pancreas and even other cancers. It has this ability to absorb water to itself. It collapses the blood vessels that go into the tumor and then prevents chemotherapy from killing cancer cells. Adding hyaluronic acid to my 3-dimensional tumor spheroids made them resemble pancreatic cancer even more. Now, this is just a couple of things that I've done to create better models for pancreatic cancer. In future, we hope to add other cell types like fibroblasts into these tumor spheroids, with the hopes that in future, it can translate into better treatment and diagnosis options for patients with pancreatic cancer, for patients like my grandmother. Thank you.